Thank you for joining us today for the 16th Annual Prostate Cancer Awareness Day. My name is Faina Stern. I'm a physician and founder of the AdMeTech Foundation, the event organizer. AdMeTech is a nonprofit organization providing leadership for the groundbreaking programs in prostate cancer at the state, national, and international levels. Our programs have been transforming patient care for everyone and reducing health disparities in Black, Hispanic, and Latino men. This event is organized by AdMeTech in collaboration with the Prostate Cancer Action Council. I'd like to express my gratitude to members of the council. Most of them are partners for over a decade, including American Cancer Society Cancer Action Network, Center for Elimination of Health and Social Inequities and Disparities, or CECSID, Community Health Awareness Grows Equity, or CHANGE, Latino Health Insurance Program, or LHIP, Massachusetts Prostate Cancer Coalition, Men of Color Health Awareness, or MOCA, 13 NAACP branches located across Massachusetts, and the Independent Blue Ribbon Expert Panel representing leading clinical experts in Massachusetts. This event is dedicated to the memory of Nakwaisaki, my father, and Representative Stephen Kulik. My father was a lifelong warrior for the vulnerable and underprivileged, particularly ethnic and racial minorities, immigrants, and the elderly. It was my dad and my family experience with misdiagnosis of his prostate cancer several decades ago that prompted me to dedicate my career to improving prevention, diagnosis, and treatment of this disease and create AdMeTech Foundation. When I met Representative Kulik in 2009, he shared his own personal experience with misdiagnosis of prostate cancer. Since that time, he became a host of the annual Prostate Cancer Awareness Day at the Massachusetts State House and a champion of AdMeTech's programs until his retirement in 2019. I hope our programs and this event have become a part of my father and Representative Kulik's legacy, reflecting their passion to make a world a better place and their commitment to helping anyone in need, particularly the most vulnerable, the disadvantaged, and the underserved. At this 16th anniversary of our Prostate Cancer Awareness Day at the State House, I will highlight the key landmarks of this event and its impact. In 2009, we held the first annual event. In 2010, Governor Deval Patrick issued a proclamation initiating a new annual tradition to recognize this event as the Massachusetts Prostate Cancer Awareness Day. Since 2011, in response to our advocacy, Massachusetts General Court created a historic precedent by recognizing prostate cancer as a central issue in men's health, public health priority, and leading health disparity. In 2013, with support of the Massachusetts legislative leadership, we established a prostate cancer research program with the priority focus on clinical trial of prostate MRI. At that time, no other public or private organizations, including NIH, were willing to support MRI and related research. Our trial showed a groundbreaking impact of prostate MRI, which improved early detection by 5 times and proportionately reduced unnecessary procedures. MRI has become the first reliable imaging tool for prostate cancer and a new standard in prostate cancer diagnosis, ending the era of blind patient care. There are no blind biopsy or treatment performed today without MRI. In 2014, we expanded prostate cancer program to include a statewide public awareness campaign and established a prostate cancer action council with the focus on high-risk individuals. While prostate cancer is curable when detected early, Black, including Hispanic and Latino men, are 2.5 times more likely to die compared to white men. In 2016, we added medical education to our program when we held the first annual global summit on precision diagnosis and treatment of prostate cancer. Unlike other educational events, which are based primarily on a single clinical subspecialty, our summit brought together the key international opinion leaders representing every clinical field involved in patient care. This summit stimulated an interdisciplinary dialogue and has been widely recognized as having a seminal impact on medical education, best emerging clinical practices, and research priorities. Our summit has been instrumental in expediting pioneering research in radiomics, including our own, integrating information from imaging and genetic testing for precision diagnosis and care. More recently, we supported recognition of and research in multi-omics, integrating imaging and genetics with other diagnostic tools. In 2022, we launched Prostate Cancer Equity Resource Project. This has been a joint effort with Margiela Brigham, UMass, NACP branches and Latino Health Insurance Program, and more recently, Beth Israel Lahey. Our joint goal is to expedite access of Massachusetts men to the best patient care available today and support them every step of their prostate health journey. This program is open to any Massachusetts man age 40 and older, and our priority focus is on Black, including Hispanic and Latino men, who are at higher risk of the delayed diagnosis, poor quality care, and death. A couple of years ago in 2023, based on our summit recommendations, we established an international working group to expedite transfer of minimally invasive focal treatment of prostate cancer from research phase to a new standard of care, with the goal to improve men's quality of life and reduce healthcare costs. Accurate imaging such as MRI made it possible to focus treatment on cancer while reducing damage to normal surrounding tissue and related complications. In 2024, our group developed strategy for expedited clinical validation and implementation of focal treatment and designed a priority pilot research study, which will be funded this year. Minimally invasive procedures are the future of prostate cancer care. They will replace radical surgery in many men, similarly to minimally invasive surgery that replaced mastectomy in women with breast cancer for the last several decades. I'd like to thank our event hosts, Senator John Keenan, who is a prostate cancer survivor, Senator Pavel Payano, who knows firsthand what it is like to have prostate cancer in his family, Representative Sean Garbalay, who watched many of his friends dealing with prostate cancer, and Representative Robert Consalvo, who is concerned about the impact of prostate cancer on men and families in his district. Our keynote speakers include Governor Maura Healey, who became the first governor to include prostate cancer program in the Massachusetts budget this year, Senate President Karen Spilka and Speaker of the House Ron Mariano, who made prostate cancer our state's legislative priority, and Representative Bud Williams, Chair of the Joint Committee on Racial Equity, Civil Rights, and Inclusion, and immediate past Chair, Black and Latino Caucus. Representative William is leading the fight against prostate cancer in Hampden County, which has one of the state's highest prostate cancer mortality in Black and Hispanic men. Our featured speakers are champions of the state's prostate cancer program, including Senate Majority Leader Cynthia Cream and Senate Majority Whip Mike Rush. Leaders of the House, including Assistant Majority Leader Frank Moran and 3rd Division Chair Carlos Gonzalez. Representative Marjorie Decker, Chair of the Joint Committee on Public Health, and Representative Russell Holmes, former Chair of the Black and Latino Caucus. Dr. David Einstein of Beth Israel Lehi, Adam Feldman of Mass General, and Mitchell Sokolov of UMass are international leaders in clinical care and our partners in Prostate Cancer Equity PCE Resource Project. They made men refer to them by AdMeTech, their priority, and will describe the cutting-edge advances in patient care they're offering their patients. George Brickhouse will share how Prostate Cancer Equity Project made a difference for him. We are grateful to our partners in public awareness. Rasan Hall, president of the Urban League of Eastern Massachusetts, and Jordan Rich, board member, Massachusetts Prostate Cancer Coalition. I'd like to acknowledge support, advocacy, and ongoing work of the key principals of the Prostate Cancer Action Council who are here today. Dr. Milagros Abreu, President and CEO of the Latino Health Insurance Program. Steve Bernard, immediate past president, and Leona Martin, past second president, Brockton Area Branch NAACP. Julian Harvey, president, and Zane Crute, immediate past president, Mystic Valley NAACP. Mark Heimovitz, Director, American Cancer Society Cancer Action Network in New England. Lamont Scott and Al Hubert, coordinators, Men of Color Health Awareness. Fred Taylor, President of the Worcester NAACP. This event was made possible by AdMeTech staff members Thomas Satam, Emma Coyard, and Emily Mao, and our outstanding interns Daniel Adonisio of Boston College, Havadan Soka of Boston University, and Julie Satterthwaite of Temple University Medical School. We want to thank our event managers, Nancy Petkunas and Josh Garneau, Nexus for Success. Technical team led by Bill Lindeknecht of KLB Production, and media expert Kate Kahn of the Gray Media Group. Finally, I'd like to acknowledge our sponsors. We are proud to be supported by global leaders in prostate cancer research and care, including Blue Earth Diagnostics and Johnson & Johnson. Again, welcome to the 16th Annual Prostate Cancer Awareness Day. It is my pleasure to introduce my co-MC, Thomas Satam, Director of Operations and Health Policy at AdMeTech Foundation, and our first speaker, Jordan Rich, member of the board, Massachusetts Prostate Cancer Coalition.
Hi, this is Jordan Rich, MPCC board member and host of the MPCC podcast series, Prostate Cancer and You. I'm here to extend a warm welcome from the Massachusetts Prostate Cancer Coalition to all PCAD participants. MPCC is proud to be a longtime partner with the AdMeTech Foundation, organizing and promoting the annual Prostate Cancer Awareness Day. You know, it's always a productive and exciting day because it showcases the strong support that all of us in the prostate cancer community receive from the Commonwealth of Massachusetts as we continue to educate, support, and offer key resources and connections for men at risk, newly diagnosed individuals, survivors, and their families. We invite you to visit our newly relaunched website, masspcc.org, for resources such as support groups, the latest in prostate cancer research and treatments, our informative podcast series, news about our upcoming May 16th symposium, and much, much more. Once again, we express our thanks to AdMeTech for organizing the annual Prostate Cancer Awareness Day. and for inviting us to participate. There have been many advances in the diagnosis, treatment, and public awareness for this disease, but there is still more work to be done. And MPCC is proud to be part of these ongoing efforts. Thank you.
Hello, everybody. Our next speakers that I want to introduce are Lamont Scott and Al Hubert from the Men of Color Health Awareness, MOCA. Gentlemen.
Good morning. My name is Lamont Scott. I'm the MOCA Project Director, and I would like to say thank you to Dr. Stern and AdMeTech for allowing us to be part of another successful Prostate Cancer Awareness Day. So what I'd like to say is thank you for allowing MOCA to continue to fulfill the work that we're doing in Western Massachusetts, but primarily in Springfield, and also to continue doing the work pertaining to prostate cancer, which is prostate cancer discriminates 2.5 times more with Black and brown men does with Caucasian men. And we'd like to say we're looking forward to also learning more about prostate cancer and also mistrust between doctors. So now we're trying to clear that facts and move forward.
Yes, good morning. I want to say thank you for Dr. Stearns and to the AdMeTech Foundation for allowing MOCA, once again, the Men of Color Health Awareness in Springfield. My name is Brother Al. I'm one of the training coordinators here in Springfield with MOCA for the last 10 years. And what got me involved was that seeing 100 men on the steps of City Hall talking about taking charge of your health. And that was so important for me. So being a part of this program and being part of AdMeTech was very important because I got education, I got the awareness, and I became an advocate for men's health through MOCA program. But the fellowship and the partnership with AdMeTech gave us this opportunity to go out in our community and talk about men's health. And I think it was so important to be a vocal in our community. We know that bringing out education and bringing out awareness and being an advocacy in the community was so important. And AdMeTech allowing us to be a part of the team is so important. There are a lot of fathers has lost lives to prostate cancer. And we don't want that trend to continue. I think it was 2015 when we realized that there were a lot of men dying of prostate or didn't know what prostate cancer was because of the stigma. And I was saying that it's not the finger that's killing you, it's the prostate cancer. And I think that was so important. It hit home to a lot of individuals or a lot of community-based organizations like faith-based churches, community centers. You know, we got out there to ring the bell in 2015 and to be here this 2025 doing the same thing. And it's so important.
And as you understand, the reason why we got involved with going out and doing presentations pertaining to prostate cancer, because our mission for MOCA is to empower the men of color, especially in the greater Springfield area in Western Massachusetts, with the tools to eliminate the health disparity. And what we've learned in the past is educate the men how to self-monitor themselves. We also encourage them to do prostate cancer screening at least once a year, especially if they're over 40 or if they're Hispanic or Black or brown men that have not been going to the doctor. We know that prostate screening will save lives and also give you a little bit of an uplift or a little more to get ahead if there are any issues that may be going primarily on with your prostate. With the education and the tools that we've been able to give them, we're looking forward to continue the work that we're doing in Springfield. Brother Al said we have organizations, senior centers, faith-based churches, anywhere that we're allowed to go. I mean, we do our own presentation just to educate men. We want men to move forward and take care of their lives. And prostate cancer is one of our biggest issues for Black and brown men, not only in the United States, but everywhere we go, we found that men are having issues with prostate cancer. And we're here looking forward to this Prostate Cancer Awareness Day. We're looking forward to getting more education, more understanding, more tools to move forward. We've been so blessed with using the tools of it to make it successful to educate the men in our community pertaining to prostate cancer.
You know, I think take-home message is so important. So we people know in our community that to benefit from the screening, you know, early detection, when treatment is possible, you know, will save lives. And that's so important. We know 40 to 75 sometimes have poor health in our community. And that's the reason why we choose to bring this education and awareness. And if we can get men to understand there is a chance that they may be diagnosed with prostate cancer, but the key is going to the doctor and being treated. Early detection saves. We want men taking charge of your health. And that's why MOCA has been around for so long. And then that's just getting education and awareness and being an advocacy of change. So, and we thank Dr. Stearns and her team for allowing us to be a part of this And as we continue to be a beacon down here in the Valley for men's health, we're just so grateful to have this opportunity. And I just want to say thank you.
Appreciate Dr. Stern, the team, and also the governor for allowing us and funding us to continue the work that we do throughout Western Massachusetts.
Thank you so much. Our next speaker is a great partner for more than a decade for AdMeTech Foundation, Mark Heimovitz, Regional Government Relations Director for American Cancer Society Cancer Action Network. Mark, please.
ACSCAN has been proud to partner with the AdMeTech Foundation for many, many years. The work that AdMeTech does through research, medical education, public awareness, and advocacy is saving lives throughout the Commonwealth. And the advancements made by AdMeTech Foundation's accomplishments are a model to be replicated across the country and around the world. We've heard the statistics, so I won't repeat them, but I will reiterate that the disparities in prostate cancer mortality are unacceptable. Black men in the U.S. have among the highest documented prostate cancer incidences in the world. The need to help reduce these disparities is what drives ACSCAN's and the AdMeTech Foundation's work. And of course, leading the AdMeTech Foundation is the amazing Dr. Faye Stern. Anyone who meets Dr. Stern is quickly blown away by her passion, her commitment, and urgency to reducing the incidence of and mortality rate from prostate cancer. That has been Dr. Stern's goal for so many years, and her work has changed the way we talk about and treat prostate cancer. For me personally, it's been a privilege and continues to be a privilege to be able to work with Dr. Stern. I've learned so much from her, and her energy is contagious. That is why today's event has such an impressive list of leaders in medicine, academia, research, government, and more. It's because of the landmark work Dr. Stern and our team at the AdMeTech Foundation has done. So thank you, Dr. Stern, for the work that you and your team do, and thank you for inviting me to speak today.
Thank you so much, Mark. Right now, we will hear a message from our sponsors.
When it comes to optimizing cancer care, improving the lives of patients through innovative imaging solutions is critical. At Blue Earth Diagnostics, we develop and commercialize precision radiopharmaceuticals for diagnosing cancer. To get the best possible image, a short waiting period will be required for the imaging agent to flow through the body prior to scanning. Next, the PET scanner identifies the locations of uptake of the imaging agent that may represent cancerous lesions. This allows a physician to see exactly where the cancer may be located. This imaging solution may facilitate an appropriate diagnosis to inform next steps for treatment.
Again, to Blue Earth Diagnostics and to J&J for their support of many years. At this point, it's a great pleasure for me to open our formal program. And the first speaker is the Honorable Maura Healey, Governor of Massachusetts.
Hi, everyone. Thanks to AdMeTech and the Prostate Cancer Action Council for inviting me to join you today. Thank you to the legislature and to the many, many health and community organizations that are here. Most of all, thank you to the survivors and their families who've had the courage to share their journey. In 2025, over 6,500 men in Massachusetts will be diagnosed with prostate cancer. Over 700 of them will lose their lives, disproportionately Black and Latino men. But we know that it's curable when it's detected early, which is why we lead in bringing cutting-edge, evidence-based strategies for screening, diagnosis, and treatment to the rest of the world. Spreading awareness is an important part of that, and the work that you're doing here today will save lives. And I'm happy to declare today Massachusetts Prostate Cancer Awareness Day. Thank you for everything that you do.
Hi, our next speaker is going to be Senate President Karen Spilka. Senate President.
Hello, I'm Massachusetts Senate President Karen Spilka. It's a pleasure to join you virtually this afternoon for Prostate Cancer Awareness Day. And thank you to the AdMeTech Foundation, the Prostate Cancer Action Council, and so many advocates for organizing this terrific event. Today, we recognize a pressing issue that affects hundreds of thousands of people. Dads, brothers, husbands, and grandfathers all around Massachusetts and all around the world. For this 16th annual Prostate Cancer Awareness Day, I am so grateful to stand alongside so many of my fellow senators and our colleagues in the House. Years ago, we came together as the first legislative body in the nation to recognize prostate cancer as a persistent and often silent health battle. That recognition paved the way for meaningful progress in policies that prioritize awareness, research, and prevention for men across the Commonwealth. Since then, the Prostate Cancer Equity Program has flourished, and because of it, men in Massachusetts get expedited access to the best available care. In the 6 years the program has been active, it has touched 60,000 lives around the Commonwealth, helping vulnerable and underserved individuals. With over 230,000 new cases reported annually in the United States, that work is more important than ever before. Because we know that early detection, strong research, and equitable access saves lives. And Massachusetts is leading the way with our global leadership in life sciences, healthcare, education, and research. The AdMeTech Foundation is a crucial partner in that work and is on the front lines of the fight, along with so many other Massachusetts-based organizations. I want you to know that I promise you that in the Senate and the legislature, we will continue to stand alongside you in this fight, in pursuit of a day when no person's life is taken by prostate cancer. Thank you very much and have a good day.
Thank you, Senate President. Our next speaker is Speaker of the House, Ron Mariano.
Hi, everyone. This is House Speaker Ron Mariano. And I want to thank the entire team at the AdMeTech Foundation for putting this event together for the 16th annual Prostate Cancer Awareness Day. I'd also like to acknowledge Representatives Sean Gavley, Rob Consalvo, and Bud Williams for hosting and supporting this event. During the early part of my speakership, so much of the work that we did in the House was about recognizing the disproportionate impact that the pandemic has had on our society so that we could build back stronger than ever. Due to the many underlying racial inequities that exist throughout our society, we have worked hard to ensure that our recovery efforts are carried out fairly. Unfortunately, many of these same inequities can also be found in the fight against prostate cancer. Over 6,000 men in Massachusetts will be diagnosed with prostate cancer in 2025. Black and Latino men are 2.5 times more likely to die from prostate cancer than white men. Because of these troubling statistics, I am grateful for the work that AdMeTech does. Over the years, the legislature has allocated millions of dollars towards funding for prostate cancer awareness, education, and research. Through your advocacy work, AdMeTech recognizes that the way to make progress on this issue is to detect and treat prostate cancer early on. Specifically, the work that AdMeTech does to spread awareness about those who are more likely to develop prostate cancer is absolutely critical. While we can all do our part by talking with our doctor about getting screened for prostate cancer, The House will continue to do its part by legislating with the racial and health disparities in mind. We know that the House is committed to working with partners like AdMeTech to do our part in helping to spread awareness and to curtail the damage done by prostate cancer. So with that, I want to once again thank you again for including me in this discussion. I'm really grateful for the work being done by so many of you, and I look forward to our continued partnership. Again, thank you so much.
Hi, everybody. Our next speaker is a longstanding champion of our program, and we're always honored to have him speak at our Prostate Cancer Awareness Day. Representative Bud Williams, chairperson of the Joint Committee on Racial Equity, Civil Rights and Inclusion, and the immediate past chair of the Black and Latino Caucus. It's an honor to have you again at this event, Representative Williams.
Prostate Cancer Day. Fired up and ready to go. First of all, I want to thank folks in Hampden County, the men of MOCA, for the outstanding work that they do. I also want to thank the Springfield branch of the NAACP, the Urban League. I want to thank leader Carlos Gonzalez, Senator Gomez, and Representative Ramos for always working so diligently when it comes to prostate cancer awareness. First of all, its protocol has been set. Governor Healy, Speaker Mariano, and Senate President Karen Spilka. Good morning. I would like to start, and Dr. Stern, I just want to give you a shout out before I get into my prepared notes for being an amazing quarterback. We have leaned on you many, many times. We have reached out to you, and I've had individual cases in which I have reached out to you for district support. You've hooked individuals up with Brigham and Women, Mass General. You just do amazing work, and your team is so outstanding. I'm so happy to be part of this amazing work that you do, and giving honor to your father, and also to former Rep. Stephen Kulik, who's one of my role models back from the 413 in Western Massachusetts. I would like to start by thanking AdMeTech Foundation for inviting me to be a part of this event. At the same event in 2011, 14 years ago, our state legislators set up a historical precedent by recognizing prostate cancer as a public health priority in all men and leading healthcare disparity in Black men. My district is located in Springfield, Hampden County, where prostate cancer mortality in Black and Hispanic men has been at the top of the state's charts for more than 5 years. In our state, Black men are twice as likely to die of prostate cancer compared to white men. Recognizing that early detection is a game equalizer, AdMeTech Foundation established Prostate Cancer Equity Program to deliver high-quality care for all. This program made a direct impact on my constituents. AdMeTech Foundation has been working with the leading state's clinical experts to ensure that all men, and Black men in particular, get the best possible care available today, and in the process, creating support and trust. Now, if anyone in my district or among my friends need help, I have every confidence that AdMeTech's equity program will take good care of them. This program set an example for our nation. You will learn more about the Prostate Cancer Equity Program later today from Dr. Stern and other physicians who are participating in this event and serving as featured clinical providers. I have an important call to action to all Massachusetts men aged 40 and older, and Black men in particular. Contact AdMeTech Foundation to learn how Prostate Cancer Equity Program can help you. This information may save your life, and the life you save may be your own. Thank you so very much.
Our next speaker is a long-term champion of a prostate cancer program. Actually, both of them. Representative Sean Garbalay, Chair, Joint Committee on Tourism, Arts and Cultural Development, and Representative Rob Consalvo, Vice Chair, House Committee on Rules. I also want to thank Representative Consalvo for being a friend to my father for many years. Representative Garbalay and Representative Consalvo, please.
I want to begin by apologizing that I have laryngitis, if you can believe it. Unfortunately, that came this morning, and I don't know if that's good or bad because now people won't have to listen to me talk all day. But I'll briefly just say how excited I am to be on this call, how thrilled I am to support you, Dr. Stern, and AdMeTech for this really important issue. This is something I've supported my 3 terms here and my time on the Boston City Council. And I just couldn't be more thrilled to be working under the leadership of Chair Garbaldi, who I'm going to let do most of the talking since I now have laryngitis. But let me just say that is a hugely important issue in my district. This is a hugely important issue in our Commonwealth. We will stand with you and your organization to make sure that we continue to get the word out to everybody, not just in Boston, but all across the Commonwealth. And I look forward to continue to support this, both in the budget, as public policy in our Commonwealth, and to continue to work with you, Dr. Stern, in the city of Boston. And so in order to save my voice, Chair Garbaldi, if you don't mind, I'll turn it over to you.
Thank you, Representative Consalvo. Sorry to make you go first, especially with your voice. You're a champion of everything AdMeTech stands for, and I'm thrilled and honored to be able to partner with you as a friend. And thanks so much for your comments. To echo the sentiment of my friend, Representative Consalvo, Dr. Stern, your work is inspiring. Your work and the work of your staff is unbelievable. What you have been able to accomplish across the Commonwealth on this issue is inspiring, and we're proud to be able to be your champions up here at the State House. So on behalf of myself and Representative Consalvo, Representative Williams, we're thrilled to be able to champion these causes in the House of Representatives and host this event along with our friends in the Senate, Senator Keenan and Senator Rush. I have a resolution that I would like to read on behalf of us, a joint resolution from the House and the Senate commending the AdMeTech Foundation on recognizing the 16th Annual Prostate Cancer Awareness Day on March 27th, 2025. And I want to thank Senator Rush and his staff in particular for doing the work in making this resolution happen. Whereas the AdMeTech Foundation will recognize the 16th Annual Prostate Cancer Awareness Day on March 27th, 2025. And whereas prostate cancer is a public health crisis, central issue in men's health, and leading healthcare disparity in Black and Hispanic men in the Commonwealth. And whereas, according to the American Cancer Society, it is estimated that prostate cancer will strike over 6,690 men and take the life of 710 men in the Commonwealth in 2025. And whereas early detection of lethal prostate cancer is critical to save lives, and research on the advancement of novel precision approaches to screening, diagnosis, and treatment are essential for individualized, high-quality patient care and can lead to millions of dollars a year in healthcare cost savings in the Commonwealth. And whereas the AdMeTech Foundation has established a Prostate Cancer Action Council, which includes the American Cancer Society Cancer Action Network of New England, Center for Elimination of Health and Social Inequities and Disparities, Community Health Awareness Network Grows Equity, Latino Health Insurance Program, Inc., Massachusetts Prostate Cancer Coalition, Inc., Men of Color Health Awareness, the National Association for the Advancement of Colored People New England Area Conference, and an independent blue ribbon expert panel representing leading hospitals and experts to create a new model of national and global leadership in improving patient care and health equity by integrating research with medical education and public awareness. Now, therefore, be it resolved that the Massachusetts General Court hereby commends the AdMeTech Foundation for recognizing the 16th Annual Prostate Cancer Awareness Day on March 27, 2025, and extends its sincerest appreciation to the AdMeTech Foundation for the continuous dedication to saving lives, improving the standard of care, and ending prostate cancer as a public health crisis and a leading health disparity, and be it further resolved that a copy of these resolutions be transmitted forthwith by the clerk of the Senate to the AdMeTech Foundation. Thank you.
Thank you so much, Representative Garbale and Representative Consalvo. We greatly appreciate your attendance and willing to host this event via the House side. We're going to introduce our first Senate host, Senator John Keenan, Chair of the Joint Committee on Election Laws. We're honored to have you join us, Senator Keenan.
Good morning. It's great to be here, and I very much appreciate the opportunity to say hello to my colleagues and to all those that are doing such great work in this field. About 13 years ago now, 12 years ago now, my father passed away, and unknown to any of us, he had prostate cancer, and that was determined to be the cause of his death. But when he passed away, he was just short of his 87th birthday. And so it didn't register with me or my brothers or siblings or anybody that prostate cancer was something to worry about. He was 87. We didn't even know he had it, and yet it was what he died from. Fast forward to just about a little over 4 years ago, I went for my annual physical blood work, and as I do every year. And generally, my focus is on what's my sugar levels. My mother has diabetes. I don't want to necessarily have diabetes, so I keep a close watch on that. And I've never really thought about the blood work. After it was done, I got a call from my doctor, said, I'd like you to come back in and just want to go over a couple things. And so I went back in, and the doctor said, I want to refer you to have some tests done. And that then began the process of going to have the blood work done again, and then to have an MRI done, and then ultimately to have biopsies done. And I was diagnosed at a young age with prostate cancer. And my numbers weren't really high, but they climbed very, very quickly. And that's what prompted the doctor's concern. I went from there to an oncologist, was advised what my various options were, and ultimately had a radical prostatectomy. And for 4 years since I had that surgery, my guess, and it's the message that's consistent with what everybody has said, it's so important to make sure that you keep annual physicals, that you request specifically if a doctor's not doing it. Most doctors do, but certain people have access to different types of doctors, and sometimes it's not as comprehensive a physical exam as it should be, annual physical. Ask the doctor to do the blood work. Specifically ask the doctor about the PSA, and make sure that there is a focus on that. And we know that this disproportionate strikes communities of color, so we've got to make sure that folks in those communities do have access to primary care. So getting people to go to the doctor, making sure they have the access, making sure that the physical exam includes blood work, making sure that the physical exam that includes blood work also includes the PSA test, and then having people specifically ask their physicians to check the PSA level. I know Representative Garbale in the resolution indicated that this year there'll be close to 7,000 people that'll be diagnosed with prostate cancer, and more than 700 of them will die. I view myself as so fortunate to be one of those diagnosed that did not die as a result of prostate cancer, and it was because of screening, detection, and a doctor that was tuned into all of that. So, and the other thing that I would say to folks is to make sure you spread the word to other people. When I was diagnosed, the first thing I did when I got home that day was obviously to tell my wife, but then I picked up the phone and I called my brothers. And I said, Dad died of prostate cancer. He was nearly 87. We think it's an older person's disease. Well, I have prostate cancer. I'm in my 50s and I have prostate cancer. So go get checked. And my brothers now do that, and thankfully they have not been diagnosed. So access to primary care, annual physicals, complete as can be, blood work that includes PSA, and then dialogue with physicians go a long way in getting the treatment so that people can not be one of the 700 plus that die in the Commonwealth, is not diagnosed, or if they are, can go on living life for a long, long time. So I want to thank AdMeTech for all that you do, Doctor. It's incredible work that you do. Hopefully we'll be able to get the funding and the budgets that's necessary and make this as routine as possible, meaning early testing and detection. And it truly, truly does save lives. So thank you for all that you do.
Thank you so much, Senator Keenan. Our next speaker is Senator Pavel Payano, Chair, Joint Committee on Consumer Protection and Professional Licensure, who had a brush with prostate cancer in his family. Senator Payano, please.
Before I get into my prepared remarks, I want to say thank you to Senator Keenan for telling us about his story and for the incredible advocacy of our colleagues in the House. Good morning. Thank you for the opportunity to speak today. It's truly meaningful to be with so many outstanding leaders, advocates, and survivors who are working to change the way we approach prostate cancer in Massachusetts. For those of you that don't know me, my name is Senator Pavel Payano. I have the honor of representing Lawrence, Methuen, and Haverhill in the Senate. These are communities that are filled with strength, resilience, and an unwavering sense of family. But for too long, our families have carried the weight of unequal access to health care. And prostate cancer is one area where that inequality shows up clearly. Black, Hispanic, and Latino men face higher rates of diagnosis and death. That is not because we are less concerned about our health. It is because we are often left out of the systems meant to protect us. That is why today matters. And that is why the work of AdMeTech Foundation and the Prostate Cancer Equity Program is so important. They are helping us move from words to action, from awareness to access, and making sure the most vulnerable communities are not treated as an afterthought. James Baldwin once said, "Not everything that is faced can be changed, but nothing can be changed until it is faced." That's what we're doing here. We're facing this disease. We're facing the disparity. That is why I'm committed to advancing health equity in our state through both my policy of work and my work in the community. And it's why we are facing the deep need for culturally responsive care that we know has the ability to save lives. We need to keep going. We need to talk openly about prostate cancer in our communities, at the dinner table, at the barber shop, at church. We need to remove the fear, the shame, and the silence that keeps too many of our men from seeking care. You know, at a very young age, I lost my grandfather. And I will say my grandfather had 96 years of life. But one of the things that we would talk about, my father would talk to me about, was that he could have lived for a lot longer if it wasn't for the fact that he did not get the care he should have gotten. And if the cancer would have discovered at an earlier age, perhaps he would have given us several more years. So that because it runs in my family, and because other members of my family have had prostate cancer in the past, it's one of these things where when I speak with my peers, I always talk about it with since my early 20s. And I think it's important to keep talking about it. It's important to ensure that we demystify this disease and ensure that men feel comfortable having these conversations. And sometimes, as Senator Keenan said, advocating for themselves, because this is just not about health. It's about dignity. It's about justice. It's about making sure that every man, regardless of where he lives, what language he speaks, has the opportunity to live a long, healthy life. I want to thank you all that are joining us today. Thank you for the work that you do and for allowing me to stand with you in this fight. Thank you and God bless.
Thank you so much, Senator Payano. Our next speaker is also a long-term champion of prostate cancer program, Senate Majority Leader Cynthia Cream. Senator Cream, please.
It's a pleasure to join you for the 16th Annual Prostate Cancer Awareness Day. Thank you, Dr. Stern, and for your dedication to advancing prostate cancer awareness and care. Prostate cancer remains one of the most common cancers amongst men, and events like this play a crucial role in raising awareness, improving early detection, and expanding access to high-quality care. The AdMeTech Foundation has been instrumental in supporting research, education, and outreach efforts that are improving how we diagnose and treat this disease. Engaging both providers and communities, particularly those with the highest rates of prostate cancer mortality, can make a truly meaningful impact. As we mark this important day, let's remember that awareness saves lives. Conversations like these empower men to get screened, understand their risks, and seek the best possible care. There is still work to be done, but coming together, we can continue to make progress in the fight against prostate cancer. Thank you again for the opportunity to be part of this important conversation.
We continue with our program. I do want to make some shout outs in the Facebook comments. I want to make a shout out to for some offices that are attending and watching via Facebook Live. Senator Fatman's office, staffers from there, the office of Senator Collins, Representative Owens and his team, Representative Cusick's office, Representative Wynn's office, Representative Chesum, Representative Honan, and the office of Representative Galvin. Thank you all for watching on Facebook Live and watching this event and always supporting our prostate cancer program. We greatly appreciate it. Next, I want to introduce another longstanding champion, Senator Majority Whip, Senator Rush. Senator Rush.
Well, this is Senator Mike Rush of the Norfolk and Suffolk District. Happy to be here once again for the 16th annual Prostate Cancer Awareness event. I'd like to thank Dr. Stern and the AdMeTech Foundation for including me in today's program and for being a global leader in the fight against prostate cancer. As you know, prostate cancer accounts for 1/8 of all new cancer diagnoses in men and is a leading cause of cancer death among men. It is also treatable when caught and treated early. Unfortunately, many of those who may develop prostate cancer are unable or unlikely to receive the screenings and treatment that would mitigate the very worst of the disease. The fight against prostate cancer is a racial justice issue. Black men are 73% more likely to develop prostate cancer than the general population. It is a veterans issue, as veterans are nearly twice as likely to develop prostate cancer as the general population. These are communities which have historically been underserved by medical fields in which the Commonwealth has time and time again committed to addressing the inequities in their case. There is hope in this fight. Through events like this and through programs like those championed by AdMeTech Foundation, we are slowly but surely raising awareness and expanding access to those who need it the very most. Once again, I'd like to thank the team at AdMeTech for their strong advocacy, as well as all of you joining us today for your contribution in the fight against prostate cancer. Thank you so much.
Thank you, Senator Rush. Thank you for your championship of our program for many years. Our next speaker is Representative Marjorie Decker, Chair, Joint Committee on Public Health. Representative Decker, please.
Thank you to Dr. Stern and AdMeTech for inviting me and convening us for this important event. I'm honored to be here. I'm proud to be part of a legislature that has prioritized investment in healthcare with additional support for closing health disparities. I want to share my appreciation for AdMeTech's impactful work and continuing to bring folks together to increase engagement and address the staggering disparity in the U.S. with regard to prostate cancer. As chair of the Joint Committee on Public Health, I'm called to address inequity in health outcomes by intentionally investing more resources in both treatment and prevention. We know prostate cancer is the second leading cause of cancer deaths of men in the U.S. Communities of color are disproportionately affected by prostate cancer, facing higher incident rates and worsened health outcomes compared to other racial and ethnic groups. Black men are almost 2 to 3 times more likely to be diagnosed with prostate cancer than white men, and they are more than twice as likely to die due to prostate cancer. These statistics are not inevitable. They are predicted outcomes of systemic racism and the consequences of racial inequalities in our healthcare system. High healthcare cost, fear of cancer debt, a lack of culturally competent healthcare, and general distrust of the healthcare system are among the many factors that reflect systemic inequalities that are pervasive in our healthcare system. As a result, fewer Black men are unable to timely access prostate cancer screenings, and without a diagnosis, early treatment cannot begin. I want to thank Speaker Mariano and my colleagues, some of whom you'll hear from today, who understand that budget and policy choices give us an opportunity to change these outcomes. The FY24 budget invested $1 million in prostate cancer awareness, education, and research. The legislature continued its support by ensuring that the FY25 budget invested over $1.2 million, with a specific focus on men with African American, Hispanic, or Latino heritage, or men who had a history of family disease, and other men at high risk. While I'm pleased to see the governor including funding for prostate cancer research and awareness, I am disappointed that it is significantly less than our FY25 final budget. Now more than ever, it is crucial that we continue investing in efforts to reduce the health disparities associated with prostate cancer, not slow down. There's still more work to be done as we enter the 194th session. The Trump administration is making changes that are harmful to our healthcare system. This means people of color and vulnerable communities will have even less resources and less access to preventative, life-saving care. This is not an easy challenge, as the Trump administration has also made it clear that we will have fewer federal resources invested here in Massachusetts. We must continue to be intentional and make policy and budget choices that close health disparity. This includes eliminating barriers to prevention, diagnosis, and treatment, and ensuring all communities of color have equitable access to high-quality healthcare. Thank you so much for having me here today, and most importantly, thank you for your advocacy and for the work that you do every day that is about saving the lives of everyone in our community, and in particular, focusing on men of color as we talk about prostate cancer.
Our next speaker will be Representative Frank Moran, second Assistant Majority Leader and a strong advocate to our program. Representative Moran.
Good morning, and thank you to AdMeTech for inviting me to speak today at the annual Prostate Cancer Awareness Day. We all know someone who has been touched by a cancer diagnosis. I know firsthand how scary that moment is for a person, their family, and their friends. In that scary moment, no one should be living with regret about failing to catch the cancer sooner. No one should have to wrestle with what ifs. I say fight a deadly disease. This is especially true with prostate cancer, as I'm sure you're all aware, early detection means saving a life. This is not generalized statistic. If prostate cancer is detected early, there is a 100% survival rate in 5 years. Frustratingly, despite overwhelming data that points to a need for widespread diagnostic tools, we are still not where we need to be. On a wider scale, no discussion of cancer diagnosis in the United States can be separated from the structure of society, the economy, and the American healthcare system. Black men are significantly more likely to be diagnosed with and die from prostate cancer than their white counterpart. They also have lower levels of access to medical care and health care insurance. This goes without saying, but it bears repeating. Each individual life is precious. Every loss is a tragedy, especially when early detections makes it preventable. I'm proud to represent Lawrence, and I'm grateful for Lawrence General Hospital and the Holy Family Hospitals nearby. But despite our best efforts, health disparities still exist. This goes beyond regular doctor's visits. Disparities are caused by the quality of affordable food, exposure to environmental pollutants, and economic stability and more. I have been a longtime supporter of AdMeTech because they do not shy away from these complications and challenges, but face them head on. While I cannot single-handedly overhaul the entire healthcare system, though this has not stopped me from trying, I can do my part, however big or small. As a state representative, I'm honored to have secured funding with my colleagues in the House and the Senate for AdMeTech to continue its important work. I'm grateful to Thomas Hatham for your ongoing partnership with my office, as well as to everyone involved in carrying out AdMeTech's mission. Thank you especially to AdMeTech President, Dr. Stern, whose leadership and passion for others inspire me year after year. Though there is much work to be done, it pleases me to know that there are some incredible people who are more than willing to do it. I'm looking forward to the day when the preventable loss of lives from prostate cancer is behind us. Thank you.
Thank you so much, Representative Maran. It's a great pleasure for me to introduce another champion of many, many years, Representative Carlos Gonzalez, who is currently leader in the House, third division chair, and former chair of Black Latina Caucus, just like Representative Maran. Representative Gonzalez, please.
State Representative Carlos Gonzalez. As we bring awareness to prostate cancer, it is crucial to highlight the significance of understanding and addressing this prevalent health issue impacting us all. Prostate cancer is one of the most common cancers among men, with 1 in 8 being diagnosed in their lifetime. Early detection is vital for men aged 50 and older, or for those with a family history of prostate cancer should consider discussing screening options with their healthcare providers. Early stage prostate cancer often shows no symptoms, which is why regular checkups and communication with your doctors are essential. Additionally, maintaining a healthy lifestyle can play a significant role in reducing risk factors. A balanced diet rich in fruits and vegetables, regular physical activity, and avoiding tobacco and sometimes liquor can contribute to a better overall health. Let's take this month to educate ourselves and others about prostate cancer. Thank you, AdMeTech, for the great work you do in providing access to information and care and making prostate cancer services #1 in Massachusetts. Together, we can raise awareness and make a difference in the fight against prostate cancer.
We will proceed with our next part of the program dedicated to Prostate Cancer Equity Resource Project, dedicated to high quality care for all. Dr. Mitchell Sokolov of UMass Memorial, Dr. Adam Feldman of Mass General Brigham, Frank Leskas of Blue Earth Diagnostic, and Dr. David Einstein of Beth Israel Leahy will describe recent advances in clinical care and research in this part of the program. The focus of my talk is on the Prostate Cancer Equity Resource Project, launched several years ago to bring these exciting advances in patient care to Massachusetts men and eliminate health disparities. Prostate Cancer Resource Project is an integral part of the AdMeTech's ongoing statewide program in prostate cancer that created a Massachusetts model of national leadership in public awareness, medical education, and research and clinical care equity. We are grateful to Governor Healy, President Spilka, Speaker Mariano, and many other Massachusetts legislators who made this program possible. Our primary focus is on high-risk men, Black, Hispanic, Latino individuals, and all men with family history of prostate cancer and increasing age, 50 and older. This program was initiated since 2009 in collaboration with multiple organizations and has 4 components. public awareness and community education, prostate cancer equity resource in clinical care, medical education, and research. Our public awareness and community outreach is focused on the most vulnerable and underserved individuals. Since last January, we reached over 10,000 underprivileged individuals. Our public awareness and education program reached over 60,000 people. For public awareness and education, our messaging is focused on the importance of screening and early detection, critical for saving lives. Early detection is particularly important for Black, including Hispanic and Latino men, who are 2.5 times more likely to die compared to white men. With early detection of prostate cancer, every man is alive in 5 years. In sharp contrast, with late diagnosis, when cancer is spread to other organs, only 28% of men remain alive during the same period of time. The centerpiece of our medical education is AdMeTech's annual Global Summit on Precision Diagnosis and Treatment of Prostate Cancer. The latest 8th annual conference took place in September last year. Over 300 physicians took part in this event from just about every corner of the globe. Our media partners published over 60 scientific presentations, reaching over 35,000 international clinicians. Our summit has been recognized as a seminal event in shaping the state-of-the-art and future vision for patient care. Our summit brings together the key international experts representing every clinical expertise to review the best emerging clinical practices and research priorities. Our international organizing committee is chaired by Dr. Raja Kohli, a professor of urology at American University of Beirut in Lebanon, who worked with AdMeTech to bring together outstanding experts across the globe, particularly from the areas previously underrepresented in the summit, including Asia, China, Hong Kong, India, Philippines, Middle East and North Africa, particularly Egypt, Iraq, Israel, Jordan, Kuwait, Lebanon, Saudi Arabia, United Arab Emirates, Qatar, Eastern and Southern Europe, Armenia, Italy, Romania, Spain, and Turkey, Latin America, particularly Argentina and Brazil. This rapidly expanded physician participation beyond the previously active regions over the last several years, such as Australia, Western and Northern Europe, and North America. Our summit showed rapid advances in patient care. In screening, our summit supports clinical practice guidelines recommended by the National Comprehensive Cancer Network, consisting of over 28 cancer hospitals and the leading experts. High-risk men, including Black men and individuals with family history of prostate cancer, are recommended to initiate discussions with their doctors about screening with PSA blood test at the age of 40. Average risk men should start screening at the age of 45. The first or baseline screening in younger men is important for identifying men at risk of lethal prostate cancer long-term over 10 years. In diagnostics, we have seen emergence of very accurate, non-invasive tools, such as blood, urine, and saliva analysis for molecular and genetic markers, and advanced imaging, including ultrasound, MRI, and molecular imaging. These non-invasive diagnostics enhanced the importance of PSA screening and shifted past concerns about screening into the dustbin of history. Dr. Sokolov of UMass will review these precision diagnostics and their impact on patient care in more detail. High-risk individuals, including Black men, carry high risk of both mortality from prostate cancer and unnecessary procedures. Consequently, it is critical for them to have access to precision diagnostics that determine for each individual man if he should or should not have invasive biopsy and treatment, and what options and clinical care are best for him. Unfortunately, in Massachusetts, compared to white men, Black men are less likely to have precision diagnostics, such as advanced imaging, molecular or genetic testing, and to undergo life-saving treatment. Prior to undergoing biopsy and treatment, it is important for each man to discuss with his doctor if any non-invasive testing is available to determine if invasive procedures are actually needed, and if yes, what kind of options would work best for him. For example, in this slide, MRI shows prostate cancer lesions and their location for precision biopsy and treatment. AdMeTech has led research, development, and large-scale implementation of prostate MRI since 1998. In 2013, Massachusetts legislature funded clinical trial of prostate MRI, which produced groundbreaking data that were presented at the Summit 2016. About 6 months later, MRI was recommended as the new standard of patient care prior to biopsy and treatment. Today, as Dr. Feldman and other physicians will show, no biopsy and treatment are performed without imaging. Precise information provided by MRI is important for early detection of prostate cancer and open a possibility of a minimally invasive focal treatment. Under imaging guidance, focal treatment can eliminate only a part of the prostate containing cancer. This is in sharp contrast to radical surgery, removing the entire prostate and requiring hospitalization. Minimally invasive focal treatment can replace radical surgery in many men, just like lumpectomy in women with breast cancer, which removes only a part of the breast-containing cancer, replaced radical mastectomy several decades ago. That's why minimally invasive focal treatment are sometimes called male lumpectomy. Male lumpectomy can be performed in ambulatory clinics with reduced complications, patient discomfort, and healthcare costs. Over the last several years, our summit showed that focal treatment has remained experimental for more than 10 years. 2 years ago, in 2023, we established an international working group to expedite transition of minimally invasive treatment of prostate cancer from laboratories to patients. In 2024, our working group completed development of a general strategy and designed a pilot study with the goal to expedite clinical validation and implementation of minimally invasive treatment. We are planning to fund this research in 2025. We expect that focal treatment may become a part of standard care in 3 to 5 years. In Massachusetts, at least 1,600 men will benefit from these procedures per annum short term, with cost savings of at least $40 million in procedures alone compared to radical surgery, and this is a conservative estimate. Our summit highlighted the importance of MRI in Black men who are likely to have lesions in the front part of the prostate that are difficult to find by physical exam or standard blind biopsies performed without accurate imaging. In men with prostate cancer, there are two pillars of the current diagnostics: MRI and genetics. While MRI shows cancer location and local spread or stage, genetic analysis of cancer tissue reveals underlying biology and probability of growth and progression. Emerging data indicate the importance of imaging and genetic testing for many high-risk men for selecting the most effective treatment. With this precision diagnostics, we can now accurately determine if each individual has a slow-growing disease and needs only a careful observation or minimally invasive procedures, or if a man has an aggressive, rapidly growing prostate cancer requiring immediate life-saving treatment. Drs. Feldman and Sokolov as surgeons and Dr. Einstein as a medical oncologist will provide their perspectives on the critical role of precision diagnostics in selecting appropriate individualized patient management strategies. You will see from their presentations that biopsy and treatment are no longer done without accurate diagnostics, including imaging. More recently, molecular imaging has been shown to play an important role in staging of prostate cancer, including presence of metastatic spread and detecting return of prostate cancer after treatment. For example, molecular imaging with PSMA has become available at the Dana-Farber Cancer Institute in Massachusetts since August 2021. On the left, we can see a regular traditional bone scan that shows no metastasis. On the right, in the same patient, molecular imaging showed extensive metastatic disease. This information is important for selecting appropriate treatment and enables delivery of a novel radiation treatment to cancer lesions located anywhere in the body. This novel treatment will be described in more detail by Dr. Einstein. Emerging data indicate the growing role of molecular imaging in improving early detection of aggressive prostate cancer, and Dr. Feldman will discuss this further. We are proud to have pioneered research and development of molecular PSMA imaging with Johns Hopkins since 2001. Mr. Leskas will provide his perspective as a representative of Blue Earth Diagnostics, which created one of the first commercial products in PSMA imaging and brought it to patients. Since 2021, our summit highlighted that equal access to high-quality care is the key factor in improving patient outcomes for all men and eliminating health disparities in Black men. It is particularly important now with so many novel diagnostic and therapeutic approaches, ensuring high-quality, personalized patient care. Without equal access to these advances in patient care, we will see a widening gap in health inequalities, including survival and mortality. Consequently, at this event in 2022, AdMeTech launched the Prostate Cancer Equity Resource Project in Massachusetts in collaboration with Mass General, Brigham, and UMass, with the mission to save lives and deliver high-quality care. More recently, experts at the Beth Israel Leahy Health System joined this effort. Supporting organizations include Latino Health Insurance Program and multiple NACP branches located across the state. Any Massachusetts man age 40 and older can take part in this program. Our priority focus is on Black, Hispanic, and Latino men who are at higher risk of prostate cancer, delayed diagnosis, poor quality of care, and death. Our goal is to expedite access to leading experts who use the most advanced approaches to screening, diagnosis, and treatment available today, and to support men every step of the prostate health journey. This program helps men to find an expert for the initial or a second opinion, in-person or virtual visits. We strongly believe that our prostate cancer equity resource, integrated with our large-scale public awareness campaign, has been placing Massachusetts in a strong position to become the first state in our country to eliminate health disparities. Experts of the Prostate Cancer Equity Program can address any questions about prostate health, from assessing an individual healthy man's personal risk of prostate cancer to informing men about all available options before and after screening, biopsy, and treatment. We are committed to supporting men every step of their prostate health journey to ensure that no man is left behind or struggling alone. To achieve this goal, we created a streamlined process of patient referral and care. This process assures that every man who comes to the program is taken care of in the way our AdMeTech team and participating doctors would like to take care of our families and friends. Emma Coyer serves as a manager of the Prostate Cancer Equity PCE resource. Emma is assisted by Erin Roberts, program coordinator, and Ekma Clay, patient educator, and other members of the AdMeTech Foundation's team. When you come to us, Emma will work with you, our team, Mass General Brigham, UMass, Beth Israel, and other clinical partners to expedite medical visits and address any needs you may have. Together, we empower each man to make informed choices that are right for him before and after screening, biopsy, and treatment. If you have any questions about our program or need assistance, please contact Emma by phone 617-523-3535 or by email coordinator@admetechfoundation.org. I'd like to share with you a few recent examples of how PCE Resource Project has been making a difference. In December 2024, Martha's Vineyard NAACP asked us to help an older Black man who expressed a lot of confusion and concerns about his care. AdMeTech staff contacted Dr. David Einstein at Beth Israel, who agreed to provide a second opinion. In February 2025, this man and his wife had a visit with Dr. Einstein, who provided a clinical consultation and contacted the original clinical care team to ensure a coordinated approach. Only last week, this patient and his wife described to me that as a direct result of Dr. Einstein's consultation, they understood their situation for the first time in the process of care and became clear about the next steps. The second example involves George Brickhouse, who in December 22 took part in the virtual meeting of the PCE resource organized by Steve Bernard of Brockton NAACP. During that meeting, George expressed the lack of trust in his care and difficulties in scheduling prostate MRI recommended by his doctor. I got concerned, and after the meeting, contacted Steve and asked him to explore with George if he would be interested in our PCE resource. In early 2023, George contacted me, and I suggested for him to consult with Dr. Kwok-Din Trink of Mass General Brigham, who can ensure the best of class care, including high-quality MRI. George has been so happy with his care that he became an advocate for our PCE resource. In late 2024, Dr. Trink relocated to Pennsylvania due to academic promotion. As of last week, per George's request, we referred him to another leading clinical expert at Mass General Brigham to assure the continuity of his care. George Brickhouse, an advocate of our Prostate Cancer Equity Resource Program, is with us today, and he would like to say a few words. George, please.
I am so blessed to be with you today. The energy and the caring that everyone who has been involved and who is involved is obvious. I am blessed that a friend of mine, Steve Bernard, asked me to join him in a Zoom call with an organization called AdMeTech that I knew nothing about, but he said you might want to hear what they have to say. I had just gotten a PSA reading from my primary doctor, who referred me to a colleague of his in their grouping. And it was kind of just, why don't we do this? this type of thing, and why don't we probe and do this? And it just kind of made me uncomfortable that somebody would not say, let's follow a procedure to do so, because my father had prostate cancer. In fact, both parents were diagnosed with cancer at the same time, which caused me to really have a hard look at what life is and what cancer can do to the community. But Dr. Stern reached out to me and said, hey, look, would you like to see what we do and how we do it? And that made me say, somebody cares about me. And as I said, I was blessed to be with Dr. Tren, who, due to his advancement, has moved on. But AdMeTech has said, hey, look, we have another person that we want you to be with, that we are comfortable with, and hope that you will be comfortable with also. So I'm excited that AdMeTech has kept me in the family. And what really generates the energy for me to be here today is that in my time with Dr. Tren, we would talk about what can we, the community, do to help our place in the world. And one of the things that I proposed was a program called the Prostate Spartans to initiate in high schools. And what the high school would do is allow us to come in and to set up the program, the Prostate Spartans. And students would be allowed to participate in an assembly-style meeting to find out what the Prostate Spartans is. The young people in the high schools have fathers, brothers, uncles, aunts, sisters that need an awareness. And if it's brought into the home, then it is something that can be discussed at the dinner table. It is something that if my loved one brings this to me, then I need to take a serious look at it. And so when Dr. Tren and I started talking once, he said, look, I'm going to pass this on to Dr. Stern and see what happens. And Dr. Stern, in my last conversation with her last week, said, look, after this gathering is done, and the fact that you have the opportunity to present this to the governor and those who run a lot of what we do by their funding, then maybe we can do what the Prostate Spartans will do. But maybe my thought was that we connect this with the Red Sox, the Patriots, all the Massachusetts. And if we bring this into the high schools, then what we can do is bring this into the communities of color. And we can have what we need to have in terms of people caring and people knowing about prostate cancer is a silent killer in our communities of color. And we need to make everybody responsible for everybody, because our purpose as individuals, God-given right, is to lift each other up. And as I said, I'm grateful that Steve Bernard said, hey, yo, my boy, get on board with this video call. And Dr. Stern followed up and said, can we help you out? And can you be comfortable with us? And I am so blessed to be with AdMeTech, with Dr. Stern. And I've got to reach out to Kate Kahn, who has been doing a lot of follow-up, and to all those on board, keep your ear open, because the Prostate Spartans, I'd like to see it in every high school in Massachusetts, and I'd like to start high schools that have a greater population of color, such as in Roxbury, Fall River, New Bedford. We can be what we need to be to help our communities be what they need to be. Stay blessed, and God bless all.
Thank you so much, George. Thank you for your presentation. Thank you for your advocacy. Our next speaker is Dr. Mitchell Sokolov, professor and chairman of urology at University of Massachusetts Medical School. He will review emerging advances in screening and diagnosis of prostate cancer. Dr. Sokolov, please.
Good morning. I'm Dr. Mitchell Sokolov. I am professor and chair of urology at UMass Chan Medical School and UMass Memorial Medical Center. It is a pleasure to be presenting today. In the next several minutes, I hope to provide some insight into emerging advances in prostate cancer screening and diagnosis. I come from the perspective of not only being an expert in the surgical management of prostate cancer, but also a prostate cancer survivor. The key to adequately diagnosing and treating prostate cancer begins with appropriate and accessible screening. The correct population needs to be targeted, and a panel of screening tests needs to be available to best determine who is at risk for prostate cancer and who needs treatment. Precision diagnostics combines the most effective combination of laboratory, radiologic, and pathologic tests. Traditionally, and currently, screening starts with PSA blood tests and a prostate exam. Any abnormalities are then followed with a biopsy of the prostate to establish if prostate cancer is present, and, if so, its aggressiveness. Today, we have multiple technologies that can improve upon traditional screening techniques. This includes artificial intelligence enhanced biomarker analysis, liquid biopsy techniques, and advanced imaging. Optimizing prostate cancer screening for high-risk population involves a targeted, personalized approach to improve outcomes while minimizing harm. Key strategies include identifying high-risk populations, which include African, Afro-Caribbean, and African American men, those with a family history of prostate cancer, and men who might have BRCA1 and 2 mutations or other genetic factors. Early and tailored screening at an earlier age and with more frequent screenings as necessary, and genetic testing should be incorporated. Use of advanced screening methods, including biomarkers and imaging, to enhance the accuracy of prostate cancer detection, to reduce unnecessary biopsies, and to improve detection of clinically significant cancers. Personalized follow-up for men with abnormal screening tests, and monitoring and adjusting based on evolving evidence are also key factors. And, perhaps most importantly, since many of the high-risk men represent underserved populations, making sure there is a focus on education, awareness, and access. By focusing on these strategies, prostate cancer screening can be more effective, particularly for those at higher risk, while we minimize harm from unnecessary procedures or overtreatment. Collectively, the following technologies represent a shift towards more precise, personalized, and non-invasive methods for prostate cancer screening and detection, with the potential to significantly improve patient outcomes. Imaging. Multiparametric MRI has become instrumental in identifying and characterizing prostate cancer. Studies have demonstrated time and time again that MRI-guided targeted biopsies can enhance the detection of significant prostate cancer and reduce the diagnosis of insignificant disease. PSMA PET-CT scans utilize radioactive tracers to identify cancerous cells, offering precise insights into the presence and spread of cancer. It was originally indicated for staging of known disease, yet PSMA PET is now being used earlier in the screening and diagnostic arenas. Artificial intelligence is being applied in many areas of prostate cancer screening and diagnosis, and it is revolutionizing the field. AI can be used to analyze large data sets to assess digital images of prostate tissue, and this can aid in predicting cancer behavior and treatment responses. In radionomics, AI can extract quantitative features from imaging studies to predict disease characteristics and outcomes. AI has made significant strides in this area, with algorithms being developed to assist pathologists in analyzing prostate tissue samples more effectively and more efficiently. Lastly, liquid biopsy involves identifying and sequencing DNA fragments shed from tumors into the bloodstream, and it can provide insights into genetic mutations and tumor dynamics. AI is being leveraged to discover and validate biomarkers for prostate cancer diagnosis and prognosis, and liquid biopsy, which analyzes blood samples for these genetic and molecular markers, is an emerging area where AI plays a critical role. In summary, integrating advanced imaging techniques, biomarker analyses, circulating tumor DNA sequencing, and artificial intelligence holds promise for enhancing prostate cancer screening and diagnosis. These innovations aim to improve early detection, to tailor personalized treatments, and ultimately to enhance patient outcomes. Continued education and access initiatives continue to be crucial, and your continued support is needed to ensure that the men of Massachusetts have access to the best-in-class diagnostics and therapeutics for prostate cancer. Once again, thank you for allowing me to participate today.
Thank you so much, Mitch. Mitch, before we will proceed with the next speaker, do you have any take-home message?
Yeah, I think the most important take-home message is what's been really emphasized in terms of education awareness, getting at-risk men the information they need and the access they need to experts to make sure that they get adequately screened. It's very exciting year after year, all the advances in technologies for screening, for diagnostics, the annual scientific meetings in September and October that you and AdMeTech put together, really set the stage for how dynamic and how quickly things can change. But it all starts with getting people to see the correct doctors and make sure they know about prostate cancer and the risks of it.
Thank you so much, Mitch. Our next speaker, Frank Leskas, Vice President of Marketing, Blue Earth Diagnostics. It's a pioneering company in the area of molecular imaging. Mr. Leskas, please.
The evolution of the management of prostate cancer has changed dramatically over the last several decades. I can recall when my grandfather was first diagnosed with prostate cancer in the late 1980s, the PSA test had just come into common practice. And unfortunately, they diagnosed him with metastatic prostate cancer, and he died from the disease just 2 years later. The innovation of the PSA test, however, did save my uncle's life. He was diagnosed in the late 1990s with a rising PSA and was effectively treated back then. And I can happily say that he is still living with prostate cancer 27 years later. A lot has changed since then, and we can think of different treatments that have become available. But most importantly, in my world, I think about the imaging that's now available. We look at patients' PSA values, that tells a story. We look at their Gleason scores, that can tell a story. We can look at the way the patient presents to a physician, and that tells a story. But the imaging can help round that story out and provide crucial information to the clinician and to the patient as to what the best treatment pathway forward is in managing their prostate cancer. In 2016, new PET radiopharmaceuticals were introduced into the market that were more specific for prostate cancer. In the past, we strictly used X-rays or bone scans, MRIs or CT scans. The innovation of PET radiopharmaceuticals for prostate cancer was a game changer and really provided a new way, a new picture of what's happening internally in the patient with prostate cancer. And why is this important? Because in some cases, depending on what the PSA level was, a physician may have treated a patient thinking the prostate cancer was still confined to the prostate or the prostate bed region. However, after doing a prostate PET scan, they found out quickly that the disease had spread beyond that area, which would have changed their treatment plan and would have provided the patient with potentially a better outcome from that treatment. So this is critically important. And I would say that if you do have prostate cancer or recurrent prostate cancer, which is when prostate cancer comes back after initial or subsequent therapy, that you should get a prostate PET scan, commonly referred to as next generation imaging, which will give a better picture of what's going on and allow you and your physician to make a shared decision on what the next step should be for your prostate cancer journey. I can say recently, with my brother being diagnosed with prostate cancer, next generation imaging really helped to shape his treatment decisions, and he is now going through his journey and hopefully will achieve at least 27 years of survival like my uncle. These are exciting times in the development of new prostate cancer imaging techniques as well as therapeutics. And I encourage you to talk to your physician about how imaging will help you make the best treatment decision. Thank you.
Thank you so much, Mr. Leskas. Any take-home messages from your perspective on molecular imaging with PET?
Just as an add-on, this field is changing very rapidly. And I think Dr. Sokolov had mentioned the changes in the imaging modalities have changed rapidly, and the information we're getting is affecting treatment more effectively. And we look at that. I mentioned a little bit about therapeutics and how we're using radioligand therapeutics now, which is another step forward in the evolution of treatment of men with prostate cancer. And I think, the future is bright. Think of what we've done in the last 20 years and then think forward what we've done or what we will do in the next 20 years. I think it's fascinating. But there's still a lot of work to be done, and really appreciate your efforts in keeping the conversation going, and hopefully we can stop this horrible disease.
Thank you so much, Mr. Leskas. Actually, Dr. Einstein, in his presentation, will talk more about the integration of molecular imaging with molecular radioligand treatment. Adam Feldman, who's urologist at Massachusetts General Hospital. He's assistant professor of surgery at Harvard Medical School and director of Combined Harvard Urologic Oncology Fellowship. Dr. Feldman will review recent advances in treatment of early stages of prostate cancer. Dr. Feldman, please.
Good morning. My name is Adam Feldman. I'm a urologic oncologist here at Massachusetts General Hospital in Boston, and I'd like to thank Dr. Stern for inviting me to speak today, and I'd like to thank Governor Healy and the rest of the state legislature for taking the time to discuss this important topic of prostate cancer. It's such an important topic for so many of our men in the state, and we very much appreciate it. So I'll share my screen. So what I'm going to talk about today, I know we've heard a couple of outstanding talks prior to this. I'm going to talk about recent advances in management of early stages of prostate cancer. So this may already have been said, but we know prostate cancer is the most common cancer in men. There's over 300,000 new cases expected in 2025 in the U.S. It's the second most common cause of cancer death. There's with over 35,000 deaths expected in 2025, and about 1 of 8 men will develop prostate cancer. So a diagnosis, you can see here, these are data from the cancer statistics, which gives us, nationally every year cancer statistics in the U.S. And what you can see is that the majority of cases that present of prostate cancer are localized, and so this is what I'm going to be discussing, and how care has evolved over the years and changed. So when we think about localized prostate cancer, in other words, prostate cancer that has not yet spread or metastasized, there are options. So there are many cases of prostate cancer for which we can try to avoid treatment, and we call that active surveillance. And the reasons that we avoid treatment is that because treatment can have side effects, and treatment can be, can affect patients' quality of life. So when it's safe to do so, and then this is mostly for what we classify as low risk disease, that we try to avoid treatment if it's safe to do so. I'll get back to that in a few minutes. Also, options are surgery. Historically, it had been open, but now mostly minimally invasive surgery. And then also radiation. That includes what's called brachytherapy or radiation seed implantation, or what's called external beam radiation, which is delivering radiation through kind of like giving x-rays, but targeting the prostate. And I'll show another image about this later. An evolving area is also focal therapy, where we're trying to not just treat the whole prostate. Historically, the standard of care, and still probably the standard of care, is treating the whole prostate, but there is an evolving area of trying to just do focal therapy, and kind of like what people have called the male lumpectomy, to compare it to breast cancer, but as opposed to treating the whole prostate. And again, I'll get back to this part of the discussion. Active surveillance, we have demonstrated, is quite safe in men. And active surveillance, especially in low-risk prostate cancer, and that means low risk, for spreading, low risk for recurring if treated, but also, most of these patients can at least start with active surveillance. And so these are data from a study, a randomized clinical trial done in England, called the PROTECT trial, where they compared surgery, radiation, and what they called active monitoring. Is a little less stringent than what we do here in the United States, and that's an important point. But you can see that the prostate cancer specific survival out to 15 years is basically equivalent. Now, here, this is an important point that there were a few more patients with metastatic development of metastatic disease or spread in the active monitoring arm. And it's important to note that within this study, there were probably a few more men with higher risk disease than we typically would do here in the United States. And their monitoring of patients was more what we would call active monitoring, active observation, which is a little bit more loose than we typically do here in the United States. So we do have a lot of retrospective data in the United States to show that it's quite safe, and I'll show some of that in a minute. One of the biggest advances in how we diagnose men with prostate cancer, as you've heard from, I believe, Dr. Sokolov, but also how we monitor men who are on active surveillance is by using imaging, using MRI. And what we then can do after an MRI of the prostate is that we then can superimpose those images onto an ultrasound that's done at the time of a prostate biopsy and more accurately target areas of concern within the prostate so that we can better characterize their prostate cancer. And this allows us then to have more confidence and more safely follow men along the path of active surveillance and then identify if and when they need treatment. So these are some of our data from MGH. We have a large cohort of men that we've followed on active surveillance. And this is from a paper we wrote a few years ago on the left that shows freedom from treatment. In other words, looking at men over time and saying, as the line goes down, it's because men then went on to progress to treatment. And what you can see is that by 5 years, about a third of men then progressed to treatment. And by 10 years, about half of men then went on to treatment. And these are data that we showed that it's very safe to do in men, typically, older men who are over 60, but also in younger men as well. It is very safe to do active surveillance, or at least start that with that path. These are more recent data from our cohort of men on active surveillance. And interestingly, what we saw is that with the use of MRI, our program of incorporating MRI into active surveillance, into our active surveillance program started in 2014. And what we see is that we're actually treating men sooner in the MRI era. And what that tells us is that we are identifying disease earlier that needs to be treated. And therefore, we think, or we hope, as Tom will tell, that we're making it safer for men to at least embark on active surveillance and then identify them, if and when they need treatment. And so I think we've heard a little bit from our prior speaker about PSMA PET scanning in prostate cancer. And we're all very excited about the development of PSMA PET. And what we're actually doing now at a few centers, including MGH, is combining PET with MRI so that we can use the PSMA PET to then better identify disease within the prostate and then hopefully better target areas of concern and identify more accurately areas of concern within the prostate for those targeted biopsies. And we're actually getting ready to embark on a study to look at utilizing PSMA PET MRI in the active surveillance setting. And we hope that this will better identify people who need treatment earlier, as opposed to then allowing men who it's safe to do so to continue to avoid treatment. One of the interesting things about MRI is we know that there's some variability in interpretation, and these are not to go through the data here, but there is variability in how scans are interpreted by radiologists and from center to center and radiologist to radiologist, even within centers. And so this is an area that I think AI or artificial intelligence really can help with standardizing interpretation of MRI there are a number of groups working on this. So I mentioned, treatment, and I'll get back to robotic, minimally invasive surgery has really become the standard of care. It's smaller incisions, less blood loss, faster recovery, and really that's where it's evolved. And so now we are seeing that there are greater options for robotic surgery. So there are other companies that are producing competitive systems, robotic systems, and we're excited about that because that will give us more options and potentially reduce costs, we hope. There are different systems. This is typically robotic systems use a number of different arms and instruments, and this is a system which is called a single port, where through just one little incision you can actually do the whole surgery. And so there are a number of different options that are improving how we're going to do surgery in the future. Also, again, I mentioned imaging, and MRI, we use MRI for surgical planning all the time. So, for every case of surgery that we do, they have a preoperative MRI, and we use that to help guide our surgery in terms of what's called nerve sparing, to help preserve or not, when if needed, preserve the nerves that affect sexual function, and then to try to make sure that we get the prostate cancer out cleanly and effectively. We also sometimes use the PSMA scan to help identify if there are areas of concern, lymph nodes of concern, potentially to help direct our care and direct our surgical field. And then the other question is, can we improve surgical outcomes in high-risk prostate cancer? We typically have not given treatment up front, systemic therapy or whole body therapy, or what's called the androgen deprivation therapy up front prior to surgery. But there's a fair amount of research, actually outstanding research being done here in Boston at Dana-Farber, including Brigham and Women's and Beth Israel. And Mary Ellen Taplin really has led this charge. She's at Dana-Farber in trying to improve outcomes for men with aggressive high-risk disease with giving whole body or systemic therapy upfront prior to surgery and using more aggressive treatments earlier to help improve cure rates. Radiation therapy also is an option for patients with localized prostate cancer, and this has there's been an enormous evolution and improvement in radiation over the past 3 decades. We used to give what's called two-dimensional radiation, which is just shining the beams in two dimensions with a fair amount of collateral tissue damage. We've then evolved to 3D conformal therapy here, and now to what's called intensity modulated radiation therapy, and also something called VMAT, to volumetric arc therapy, where we can, our radiation oncologists, I should say, can more effectively target the prostate and minimize the collateral injury to other tissues. And also we can use biomarkers to better select the radiation treatment plan. This is just an example of an artificial intelligence platform called Artera to help select men who, along with radiation, would benefit from hormonal therapy to suppress testosterone around the time of radiation. So we're very excited about platforms like this to help guide therapy and personalize therapy. Focal therapy is an evolving area. There are a number of different ways to ablate the prostate tissue. There's high-intensity focused ultrasound, transurethral ultrasound ablation, cryoablation, laser ablation. And while we can ablate the tissue, we do need to have improved imaging, and we hope that PSMA PET MRI can maybe even help better identify where those areas within the prostate need to be treated to better effectively maximize the outcomes for patients undergoing focal therapy. We at Mass General Brigham also have really made great efforts to improve access to prostate cancer screening, diagnosis, and treatment for our underserved populations through what we've described as the Prostate Cancer Outreach Clinic. It's an effort that we've collaborated very strongly with AdMeTech and other organizations around the state to try to, and here are a list of some of our collaborators, to really try to improve outcomes for all men in the state with prostate cancer. And we're very excited about this and continuing to expand this program across the state and within MGB. So we know the standard of care of treatments of localized prostate cancer remain active surveillance, surgery, and radiation, with or without hormonal therapy. We know that improvements, or we hope improvements in imaging, they have and will continue to advance the care for our patients. We hope that earlier intensive therapy for high-risk prostate cancer will hopefully improve outcomes for these patients, and improving care for all our patients, including the underserved, will maximize outcomes for our populations across the state. So again, thank you so much. Very much appreciate everyone taking the time. Thank you.
I would like to thank Dr. Feldman and Dr. Sokolov for having been working with our prostate cancer equity program to prioritize men, underserved men who we are referring to them. And it usually takes 4 to 6 months for patients to see Dr. Sokolov or Dr. Feldman. They are making every effort to see patients we are referring within a few weeks. Thank you so much. And it's a great pleasure for me to introduce a new clinical provider for prostate cancer equity program, Dr. David Einstein. I just described one of the recent patients that he took care of. Before Dr. Trink left for Pennsylvania, he actually told Dr. Einstein about our work. And Dr. Einstein contacted us and offered to help. So thank you so much for that, David. And it's once again, it's a great pleasure for me to introduce you. David is an assistant professor at Harvard Medical School, an attending physician at Beth Israel Deaconess Medical Center, genitourinary medical oncology program. He will review, he's a medical oncologist who will review recent advances in treatment of advanced prostate cancer. David.
Hello, everyone. It's a great honor to be with you here today. My name is David Einstein, and I lead the GU Medical Oncology program at Beth Israel Deaconess. So I'd like to talk a little bit about advanced prostate cancer from a medical oncologist perspective. And I'll start by just saying that prostate cancer is a very common diagnosis in the US. Here are some estimates from the American Cancer Society. And it turns out that only a small fraction of patients with prostate cancer will actually die of their disease. Most prostate cancer either doesn't require treatment or can be treated very successfully with local approaches that you've heard about. But even a small percentage of a large number of people is still a large number of people. And so you'll see that deaths due to prostate cancer are still the #2 cancer killer among US men. And unfortunately, these two lines may cross as lung cancer incidence decreases and prostate cancer advanced diagnoses pick up. So we really need to do something to address that. It's a very sizable population. And so I'm going to cover a couple of different areas, going both from what's standard to things that are either emerging or about to emerge in our advanced treatment paradigm. And so I'll start by just giving you a little bit of background on how we treat prostate cancer. And it turns out that prostate cancer is really driven by this pathway whereby androgens, things like testosterone, can come in and attach themselves to this thing called androgen receptor. And that kind of drives the cell to replicate and produce PSA and continue growing. So we can do a number of things to shut down this pathway. And we've been doing this for, in some cases, many decades. So this is the fundamental thing that we're trying to shut down here. And it's been known for, again, decades that we can remove testosterone and very effectively shut down this pathway, at least for a period of years. In the past just couple of decades, we've also known that we can block the generation of other types of androgens in the adrenal glands and in the prostate cancers themselves through a drug called abiraterone. We also have a whole class of medications that go after this androgen receptor directly. So we don't need to know too much about these individually, other than to know these are all forms of hormone therapy and are getting at this, this driver of prostate cancer. And what we used to do was basically just take away testosterone, either by actually removing testicles or by using injections that sort of shut down the testicular production of testosterone. And by doing that, we could, again, gain many years of disease control, but then eventually the patients would become resistant, or castration resistant. And at that point, we would add in other treatments, which would work for a period of time, and then unfortunately stop working. Now, a whole series of trials has shown us that if we do more than that early on, we can actually do better. So if we add in something called docetaxel, which is a chemotherapy, we can prolong this whole process. If we add one of these other hormone therapies early rather than waiting, that too will prolong survival. So those are good things. Sometimes we can even add all three together and really try to go after this thing aggressively at the beginning. Unfortunately, none of these things are curative, but they can gain some disease control for, again, several years. So some other types of therapy that don't rely on hormone therapy have been developed with the idea to overcome some of that resistance and maybe even add further agents that we can use upfront to try to be more aggressive. So one thought is, could we use radiation, which we've known about for a long time in prostate cancer, but actually kind of selectively deliver it only to prostate cancer cells? And so this is a drug called PSMA lutetium, more commercially known as Pluvicto, and this is now an FDA-approved treatment for advanced prostate cancer. And essentially what you have here is a small molecule that goes after something on the cell surface called PSMA, and that's something that almost exclusively expressed on prostate cancer cells wherever they are in the body. And then it kind of carries this radioactive payload and kind of selectively delivers it to the cancer cell once it binds to that target. So that's a very attractive idea, and we can actually image this target and then treat it, which is very intuitive. And we've seen in clinical trials that patients do live longer compared to sort of standard of care, which was best available supportive care in the very advanced setting. So this is something patients are getting now, and we're experimenting with whether we could use it in even earlier disease settings and understanding who's most likely to benefit or become resistant. Now, there's been a lot of talk about immunotherapy in oncology, and it's a very attractive idea, the idea of using one's own immune system against cancer cells. Unfortunately, some of the most commonly used immunotherapies, things like checkpoint inhibitors, which you see ads for all over TV, really haven't been so successful in prostate cancer. However, there is a newly generated type of treatment. This has actually been used in things like leukemia for a while, but this is a way of basically using a molecule, an antibody, to pull T cells, which are immune cells that can recognize and fight cancer, and sort of match them up with these tumor cells that express a certain target. And so these are called bispecific T cell engagers. And the idea is really just to bring in those cancer-killing immune cells and try to make them do their job against the tumors. And so there is a version of this that's been created for prostate cancer. There's actually several. One is in phase 3 development now, which means that we're looking to see whether this could become a standard approach. Now, the challenge with these is that they do potentially cause a lot of side effects. And so we need to be very careful and monitor patients very closely, sometimes even the hospital, for immune type side effects. There is the other idea in oncology has been targeted therapy, which is a really attractive concept about sort of going after vulnerabilities in cancer cells selectively. And so the way that we do this in prostate and a few other cancers is by going after the way that cancer cells repair their own damage to DNA. So cancer cells are constantly accumulating DNA damage or DNA lesions, and they have a couple of different ways of fixing that. But some prostate cancers and other cancers might not be able to use one of those pathways. They might be deficient in one of those pathways, and we can pick that up using some genetic testing of the tumor. And so they're sort of more reliant on another pathway, which we actually have a drug for. And so if we block that other pathway, it has no option but to die. And so in patients with some of these selective loss of DNA repair pathways, things like the BRCA2 gene, these PARP inhibitors can be quite effective. And these are just some clinical trial data showing that. And so this has been standard of care for the last several years in prostate cancer to test for these types of genes and go after them with these drugs if we see one of those. Now, unfortunately, most patients do not have one of these targetable genes. So while this is highly effective for a subset of prostate cancer patients, clearly the majority of patients still need other options. And finally, I just wanted to touch on the fact that we've talked a lot about adding therapies or kind of novel therapies, but there's also questions about, how do we really make quality of life the best it can be and really care for the whole person? And so one concept there is opposite of what I told you at the beginning. Could we actually de-intensify? Could we start giving our patients treatment breaks if they're doing really well? Could we even try to use drugs that don't cause menopausal type side effects, don't drop testosterone, and then save those testosterone dropping drugs for later? So these are things that have varying degrees of evidence or are being studied in various ways. I also think it's really important that we not lose sight of the big picture and the experience of being a patient. And so we're very encouraging of early palliative care involvement, social work involvement. This goes hand in hand with cancer care. It's not a substitute, or it's not mutually exclusive with cancer care. These are a lot of the topics that I tend to talk about with my patients. And I also am involved with a support group, which I think has been very helpful for a number of my patients. And just to put in a plug for that, in the Boston area, this is open to all, even beyond Boston, and is not hospital specific. So any who are interested can get more resources and join monthly meetings at this website. So with that, I'll thank you for your attention and encourage you to think a lot about this as a broad population need and something that affects a large number of men and their caretakers throughout the Commonwealth. Thanks so much.
Dr. Hines, thank you for taking care of our patients, and thank you for your presentation. Any brief take-home messages?
Thanks so much for this amazing event, and really glad to be a part of it. I think you can tell from all of the things that I presented that there's a lot of excitement and a lot of development going on. For better or for worse, this is not a rare disease. And so that does mean that there's a lot of need, but also a lot of interest in developing. I think what's critical, obviously, is that we not lose the next generation of therapeutics. And clearly, we're at a moment right now where that is incredibly vulnerable. So we're hoping to make sure that the both clinical, translational, and basic sciences continue to get funded.
Thank you so much. We will proceed with our next speaker, Roxanne Hall, President and CEO, Urban League of Eastern Massachusetts.
Hello, I'm Roxanne Hall, President and CEO of the Urban League of Eastern Massachusetts. I'd like to congratulate AdMeTech on this 16th Prostate Cancer Awareness Day. Urban League of Eastern Massachusetts is a proud partner of AdMeTech in raising awareness about prostate cancer and, more importantly, prostate cancer prevention through screening and other initiatives. We are a 105-year-old civil rights organization that came into existence at the turn of the century when Black people were fleeing racial violence and oppression in southern states, coming to the North looking for better opportunities, only to be met with racial violence and oppression. And it is through the efforts of the Urban League that we began to address some of the conditions around employment and housing and educational opportunities. And over the last several generations, that is the work that we have been committed to, empowering communities and changing lives. And so within the last few decades, we have pivoted to include concerns around health and health equity. And you will hear or have already heard about the overwhelming disparities in prostate cancer and cancer death rates in the Black community. And that is why it is ever more important for this day of awareness to take place, but also for organizations like ours to be a part of the awareness raising and prevention initiatives that are happening throughout the Commonwealth of Massachusetts. We are particularly concerned about the health and well-being of our community, but especially the men in our community when it comes to prostate cancer. That's why we proudly support the work and awareness raising that AdMeTech and many other partners are involved in. Personally, I have had the opportunity to be in community and relationship with men who have been able to be survivors because they detected early. They were involved in screening processes early. But I've also had my own personal experience because I was told that Black men should be screened at an earlier age because of the higher rates. And ultimately, what I come to find out is that if you cannot advocate for yourself, or if you do not have a healthcare provider that is in tune to some of the disparities, that we can be met with opposition. And that's what happened to me. When I raised concern and requested a prostate cancer screening from my healthcare provider, they said, "Oh no, you don't need to worry about it. You're too young." I sought a second opinion and I received a screening. Fortunately for me, there was nothing to be concerned about. But the fact that I was told that I have nothing to worry about, when in fact, Black men are disproportionately more likely to be screened for prostate cancer and disproportionately more likely to die from prostate cancer, I found it disturbing. And so here I am, someone with a professional background and an awareness of these issues, able to advocate for myself, but think of the many others who aren't. And so days like this, organizations like ours and like AdMeTech become ever more important to continue to raise awareness, to educate the public, but also to encourage people to get screening, to encourage organizations and individuals to support funding for research and for the development of medicines and treatments that can prevent this disease. Continue to reach out to the people that you know, care about, and love. Continue to encourage the men in your life to increase their understanding and education of the importance of screening. Continue to encourage them to advocate for themselves to make sure they get the care and the treatment that they are entitled to. We will continue to do the work as the Urban League of Eastern Massachusetts to empower communities and change lives. And part of that begins with actually saving lives. So thank you again for this opportunity. I look forward to all of the work that is ahead. And congratulations again, AdMeTech, and thank you for your leadership in this space and all of the great work that you do.
Sure. Before we get to our next speaker, I do want to mention some other shout outs for Representative Phillips, Representative Howard, the office, Rep Cabral's office, and Rep Pupilo's office. Thank you all for attending via Facebook Live. We're always grateful for your support of our prostate cancer program. Next, I want to introduce Jillian Harvey, President of Mystic Valley NAACP.
Good afternoon, everyone. I'm delighted and honored to be a part of the 16th Annual Prostate Cancer Awareness Day, hosted by the AdMeTech Foundation. My name is Jillian Harvey, and I'm the president of the Mystic Valley Area NAACP, the National Association for the Advancement of Colored People. Our branch proudly serves the towns and cities of Malden, Medford, Everett, Winchester, Woburn, and Arlington. I'm truly grateful for our partnership with the AdMeTech Foundation and the availability of the Prostate Cancer Equity Program here in Massachusetts. We know that prostate cancer is the most common major male cancer, affecting 1 in 8 American men. We also know that Black and brown men, including Hispanic men, are 2.5 times more likely to die from prostate cancer, even though it is curable when detected early. Many of the communities that our branch serves have higher numbers of Black and brown men that this information and this program can be and is life-changing for. In the context of the United States, we know that race is correlated with health outcomes, and that racial bias exists within our healthcare systems, including preventative care and treatment and what is offered to some and what is not offered to others. I am proud of our local leaders in our communities and state and the medical experts who have worked to make the Prostate Cancer Equity Program possible, as this is a step in the right direction of correcting racial health inequities and worse outcomes for Black and brown men. This is helping folks take more control of their health. It has been a pleasure hosting our annual prostate cancer awareness event with the AdMeTech Foundation, in which we're providing live information, offering time for questions and answers, and we're giving folks guidance about the steps that they can take to educate and protect themselves and their loved ones against prostate cancer. We share those resources and information with trusted local leaders and stakeholders and encourage men to take advantage of this invaluable resource that is right here. The Prostate Cancer Equity Program is a model for other states. I look forward to continuing this partnership with the goal of improving the health and well-being of our communities. Thank you.
It's a very special pleasure for me to introduce Representative Russell Holmes, former chair of Black and Latino Caucus in Massachusetts and a long-term supporter of our program. Thank you so much for joining us, and thank you for your long-term support. Representative Holmes.
Well, thank you. As Dr. Stern may have mentioned, I've been here from the beginning, having this conversation around how we bring more awareness to communities here at the Black and Latino Caucus, and still obviously till today. I represent the Blackest neighborhood in the entire Commonwealth, and we have been in churches, we've been in community meetings, understanding that this disparity between Black and Hispanics and white must be eliminated. And so again, today, I thank all of the doctors, Dr. Stern, your team, for again, just bringing out awareness. I still continue to learn each and every day. It's great to hear even the information around making sure we are making the right decisions when it's time to go and do surgery and make decisions that we don't harm people more just by some of the treatment than we do by the diagnosis itself. Through your efforts, and we still have quite a bit of way to go because of the fact that we absolutely have to be at least at parity between Black and Hispanic and white folks. So I just want to just continue to just advocate strongly, say to you that continue to advocate strongly with the Speaker and the Senate President to get you the funds you need. So we look forward to seeing you again next year and advocating strongly again next year. And thank you all for taking the time today. You have a great day.
Always grateful for your support, as always. Our next speaker is going to be Zane Crute, immediate past president, Mystic Valley NAACP, and immediate past secretary, NAACP, New England Area Conference. Zane?
Happy to be with you today. My name is Zane Thomas Crute, and I'm a lifetime member of the NAACP, the former secretary of the New England Area Conference of the NAACP, which is our state area conference, which encompasses the states of Massachusetts, New Hampshire, Vermont, Rhode Island, and Maine. I'm also the immediate past president of the Mystic Valley area branch of the NAACP, and I still serve on the executive committee. I've held the presidency for 6 years, and I'm going to be part of the branch and a lifetime member from infinity to infinity. The Mystic Valley area branch covers Medford, Arlington, Malden, Woburn, Winchester, and Everett. So now, 2025 has been stressful as heck, I'm not going to lie. Not much has been going good this year, from inflation to drama in our government to wild weather like the wildfires that were happening in California. All of that being said, I want to stress something that needs to be stressed today, and that is the 16th Annual Prostate Cancer Awareness Day. The AdMeTech Foundation has been driving this for many, many years now, and they've been one of the pillars in our community in prostate cancer research, awareness, and advocacy, and NAACP has been a great partner of AdMeTech. I would like to stress the importance of early detection. I would like to stress the importance of Black and Latino men getting tested. I would like to stress the importance of spreading awareness. This cancer is one of the cancers that can really be beat if we catch it early. It's the best way to save lives, the best way to control one's health care, especially if one is a man of color over 40 years old. I'm not 40 yet, but I'm slowly approaching, and I'm looking forward to ensuring I'm going to live a lot longer than 40 by taking my health care serious and ensuring that I guard against prostate cancer. And if I do have prostate cancer, I take the necessary steps for treatment. All we got to do is get detected early, take your treatment seriously, and this is definitely a cancer that you're going to beat. Trust me. I urge everyone to help reduce the impact of prostate cancer in our communities. Take your own health care serious. Encourage your loved ones. Trust this process and we can truly make a difference. I urge everyone to rely on the AdMeTech Foundation for help and support in regards to this fight. Let's go out and fight this cancer. We're going to win.
Thank you, Zane. As always, we always appreciate your support. Our next speaker is going to be Fred Taylor, President of Worcester NAACP. Fred?
Today, I'd like to highlight a significant partnership that has blossomed within our community, one that has embodied the spirit of collaboration and shared commitment to health and well-being. I'm speaking, of course, about the remarkable relationship between the Worcester branch of the NAACP and AdMeTech, an organization dedicated to promoting awareness and education surrounding prostate cancer. As many of you know, prostate cancer is a pressing health challenge. Worcester is leading the county for mortality among Black and brown men, making our mission all the more critical. The Worcester branch of the NAACP has long been committed to advocating for a health and wellness of our community, and partnering with the AdMeTech has allowed us a broader impact in reaching more individuals with vital information. Under the leadership of Dr. Stern and her dedicated team, we have been able to bring together a diverse array of stakeholders, including healthcare professionals, community leaders, and families affected by prostate cancer. Together, we have created a supportive environment that emphasizes the importance of education and proactive health measures, particularly in promoting prostate cancer screening. Dr. Stern and her team have worked tirelessly to inform our community about significance of early detection. Prostate cancer, when caught early, can be treated effectively. By encouraging regular screenings and open dialogues about health, we empower men to take charge of their well-being and to discuss their health with their families and healthcare providers. This partnership is also focused on dispelling myths and addressing concerns surrounding prostate cancer screenings, a crucial step in ensuring that everyone has access to care they need. Our hope and goal is clear: to eradicate prostate cancer in our community and beyond. This ambitious goal may seem daunting, but together, with the support of AdMeTech and the dedication of our community members, we can achieve it. We must continue to advocate for a better healthcare access, education, and resources for our families and friends. As we move forward, I encourage each of you to remain vigilant about your healthcare. Talk to your loved ones about prostate cancer screening and share information you've gained. It's through education, awareness, and community engagement that we can make a significant difference. In closing, I want to express the deepest gratitude to Dr. Stern and her team at AdMeTech for their unwavering commitment to our community and for partnering with the Worcester branch of the NAACP. Together, we are forging path towards a healthier future, one where prostate cancer no longer a threat to our family and friends. Thank you for your attention, and let's continue to work together for a healthier well-being for our community.
Thank you, Fred, in helping us reach people in Worcester. Our next speaker is going to be Dr. Manogram, President and CEO of Latino Health Insurance Program. Dr. Abreu.
I'm going to be talking about our prostate cancer awareness and prevention program. We wanted to thank AdMeTech Foundation, thanks to these fundings and the legislators in Massachusetts. May enroll in the program receive the following services: 101 education to discuss the risk to develop prostate cancer. These individuals have clinical encounter with licensed Massachusetts health professionals and informed decision making so they can make the best decisions about their health. LHIP clinician, these programs are also delivered in multiple languages, have received training from high skilled professionals to meet the standard of care thanks to AdMeTech. We provide free PSA testing. This program has reduced disparities in access to healthcare and treatment for these men. We do also have to acknowledge the impact of COVID-19 for many of these men who have prostate cancer. They are at a higher risk for developing COVID-19, more serious disease. So we provide education about COVID-19 virus and providing them with the vaccines and testing. We refer these individuals to a specialist based on the results of their testings. They receive appropriate referral also not only for urologists, but other specialists like cardiologists, endocrinologists, and so because many of these men have other conditions. We also provide patient navigator to assist them, not only to them, but their families to apply for medical dental coverage, evidence, nutritional programs, financial assistance, housing, and so. We understand that family is an important part of these programs. So these programs are being delivered not only to the men who can be at risk of prostate cancer, but also to family members, their wife, their mothers, and everyone in the household, because the support that they can get from the family members. And also sometimes we as a woman are the one who make strong decisions about our men's health. So we wanted to make sure that they have the support and the understandings of the members in the home. So some of the important aspects of LHIP is our partnership across the state. We deliver these programs in multiple areas in Massachusetts. So this education and awareness has been delivered in Worcester, Boston, Framingham, and Metro West, thanks to our collaboration with faith-based organizations and also Board of Health, Housing Development departments, other organizations, and multiple other community members. Our organization has a commitment to prevention. So we believe that by providing strong education and screening access to members from these communities, we can have better health outcomes. We can improve the quality of life, and overall, we can reduce healthcare costs. Not only prostate cancer, our organization is also providing education, assistance, and other services such as diabetes prevention program, breast cancer screening, and cervical cancer screening and education, and also vaccines for children and adults, and especially right now with the COVID-19 vaccine effort. In our prostate cancer prevention program, many of these individuals have other conditions, and the majority of them were found that they are also diagnosed with hypertension, obesity, prediabetes, and other chronic diseases. So our efforts are also to educate them about how they can reduce their risk and to live healthier lives. So just to tell you about our program result from last year, 850 men received PSA screening and counseling about the risk of prostate cancer. 160 from these men received additional evaluation and treatment. 11 from these men were diagnosed with treatable prostate cancer. 200 of these men completed education such as diabetes prevention program, diabetes self-management program, blood pressure screening and control, because they were found to have these other diseases, and we educate them about how to manage this condition. 800 of these men received the COVID-19 vaccine, and they were residents in Massachusetts from the following communities: Metro West, mostly from Framingham, Ashland, Natick, Worcester, Milford, and other communities in Massachusetts. We wanted, with your support, to create equitable and accessible communities for all in Massachusetts. I would like to thank to each and every one of you who are attending this program, because with you, we are being able to do all these efforts in collaboration. So thank you so much.
Thank you so much, Dr. Milagros. It's very special for me to introduce Steve Bernard, immediate past president of Brockton area branch NAACP. When I met Steve more than 10 years ago, he was president of Brockton NAACP. And he, together with Leona Martin, have become very strong partners in transforming situation in Plymouth County and Brockton for Black men in particular. They also told us they also taught me and other members of the AdMeTech staff about the critical importance of the broad community outreach if you want to make a difference. Steve, please.
Congratulations to Dr. Faina Stern and AdMeTech Foundation on the 16th Annual Prostate Cancer Awareness Day. My name is Steve Bernard, and I am a former president of the Brockton area branch of the NAACP. We partnered with AdMeTech Foundation in 2015. Brockton and Plymouth County had the highest mortality rate in the state. Since 2016, the Brockton area NAACP and AdMeTech Foundation have held forums twice a year providing awareness and education, due in part to our efforts to encourage and empower men to take care of their prostate health. The mortality rate for prostate cancer in Brockton and Plymouth County is significantly reduced, and the mortality rate for Black men is near parity to that of white men. During our forums, we featured presentations by top urologists from Massachusetts General Hospital, Brigham and Women's, Beth Israel, Dana-Farber, University of Mass Chan Medical School, and Greater Boston Urology. We presented updates on precision diagnosis as far as screening, detection, and treatment of prostate cancer. We heard from prostate cancer survivors about their journey with prostate cancer. We were honored to have members of our state delegation, senators, and members of the Massachusetts House of Representatives speak on their support of our programs and for state funding. A most important part of our forums is the Q&A. Participants have the opportunity to ask questions of our presenting medical professionals. Feedback from our participants has been overwhelmingly positive. We have successfully encouraged men in Brockton and Plymouth County to speak with their doctors about prostate cancer screening. Prostate cancer strikes 1 in 8 American men. Black men are 2.5 times more likely to die. The emphasis of our efforts is on Black men of African and Hispanic descent. This population is oftentimes at higher risk of poor quality care. Early detection of prostate cancer saves lives. Black men should begin screening at age 40. To reach the population of higher risk, the Brockton area NAACP and AdMeTech Foundation are willing to meet the people where they are. We have been approaching Black and Hispanic churches, fraternal organizations, civil rights organizations, advocacy, and social organizations. Since the COVID-19 epidemic, our forums have been held virtually. Although we miss the personal contact, the communities can participate from home on their PCs or cell phone or by viewing the replays at their convenience. We have had strong support from the mayor of the city of Brockton and the city council. During COVID-19, we added to our forums updates on Brockton's COVID statistics. Men in Brockton who have participated in the forum and followed our progress have been helpful in sharing our message with their family and friends. I refer to them as ambassadors, and I stay in touch with them. They realize the importance of remaining vigilant in our fight against prostate cancer. 3 years ago, AdMeTech established the Prostate Cancer Equity Program in collaboration with Mass General Brigham's and the University of Mass Health Systems, and supported by NAACP New England Area Conference and Latino Health Insurance Programs. The mission is to save lives and make sure that no man is left behind or struggling alone. Prostate cancer is the most common male malignancy and a leading health disparity. The goal of the program is twofold. 1, to expedite men's access to leading experts who can offer the best prostate cancer care available today, and 2, to support men every step of their medical journey, organizing visits to doctors and addressing any concerns related to insurance, transportation, and other issues. In particular, we would encourage any man 40 and older to take part in the program if they did not have screening with PSA blood test. This test is critical to early detection and saving lives. If you join the program, you'll have the opportunity to talk to doctors and decide if PSA screening is right for you. Any Massachusetts man age 40 and older is welcome to take part. Our priority focus is on Black, Hispanic, and Latino individuals who are at greater risk of delayed diagnosis and poor quality care. Our program expedites visits with experts for initial consultation and a second opinion. It has been an honor and a pleasure to serve as a member of the Brockton Area NAACP and as a community coordinator for AdMeTech Foundation. Thank you very much.
Thank you, Steve. It's always an honor for you to speak at this event and continuing the great work that you do for our organization. Another great advocate for our organization in our program, I'm proud to introduce Leona Martin, past second vice president and member of the Health Committee, Brockton Area Branch, NAACP.
I'm here today just to talk about the great work and partnership that we, the Brockton NAACP, have had with AdMeTech, specifically Dr. Stern and her team. We met Dr. Stern in 2015 at a New England area conference NAACP meeting where she did a wonderful presentation on prostate health. And immediately after her presentation, the then president, Steve Bernard, and I went over to introduce ourselves to her and talked about how it would be great if we could have her work with us to communicate this information to our men here in Brockton and how we could educate them on prostate health. So that's really when our journey began working with AdMeTech. We held several in-person forums at the time. We got pretty good participation from men in the community, and we also had great support from our mayor and from other state legislators here, city and state legislators here in Brockton, to support the work that we were doing. And we even held it together and stayed on the course during COVID, because when COVID came, obviously we weren't able to do the live events, but we carried on, continued to do events virtually. And, you know, I can't say enough about the fact that we empowered men in our community. And I must say as well, I think we saved a few lives for men who didn't have the level of knowledge that AdMeTech was sharing and were able to have honest and open conversations with their physicians, and also to let the physicians know that they wanted the PSA blood tests. And some of them men told us that they had never been talked to about the importance of getting a PSA blood test. So that was very enlightening for them. And we also shared with the men that you're not getting what you want from a particular doctor. You certainly had the right to move on and to go see another physician. But so many of those men are still with us today. They're so very thankful for having, you know, attended our events. Some of them still attend our events. And it's just been a wonderful thing to work with Dr. Stern, AdMeTech, the whole team, to do the work that we've done, because we know we've made an impact. And I look forward to working with them for many years to come. I'm really excited about and thankful about the PCE program, the Prostate Cancer Equity Program that they've developed, where men can seek second opinions if they get some kind of a diagnosis or are just told something that they're unclear about. And we've worked with some wonderful physicians, partners, UMass, Dana-Farber. On a more personal note, a brother of mine actually took advantage of the PCE program, and he's not someone that is easy to work with. He's not very trusting, and he's not very good about trusting doctors. But we were able to get him on board to seek second opinions, and he's been happy. He's come to me and talked to me about how great these doctors have been, and they set him at ease and spoke to him in a language that he could understand. So he's grateful. I'm grateful. The family is grateful that the PCE program has been a help to him. And I certainly will refer any other family members to the PCE program if the need arises. So I just look forward, as I said, working with AdMeTech for a long time to come. They're wonderful. I view them as family, and I trust them and the care that they provide, not just for my family, but anyone in the community that needs to go through them. I thank you, and I'm just so thankful that our city and state legislators have been on board with us as well. That's been a great help and support. Thank you.
Thank you so much, Leona. Thank you so much for a decade of exciting partnerships that made such a big difference in Plymouth County. Our program is coming to an end. I would like to thank our speakers. I would like to thank our audience for your participation. And I would like to thank our team again and our sponsors. Thank you so much to everyone, and I hope you will have a great day. Thank you.